Hello, this recording is for CPT coding and treatment of fractures and or dislocations. So your main term for treatment of fractures or dislocations is going to be either fracture or dislocation, and then you are going to go down for a subterm to the bone or bones that are involved in the fracture and dislocation treatment. So one of the first things that is explained in this section of your textbook is that your CPT code selection for treatment of a fracture is according to the type of treatment, not the type of fracture, but the type of treatment. That cannot be overemphasized. A patient can have a closed fracture but receive open fracture treatment. So knowing what the definitions of these are, and you can look back in your resources, but basically a closed fracture is one where there is no open skin exposing the fracture. That's a closed fracture. Think of the skin being closed. An open fracture is where there is an opening through the skin exposing the fracture. Now, in a closed fracture, you can have either a closed treatment or an open treatment. And the definition of open and closed treatments are: do they cut in and expose the fracture, which is open, or do they not? With an open fracture, you are going to likely have an open treatment because the fracture is already open. There is another type of fracture repair, and that is percutaneous fixation, and it's really neither open nor closed repair. Instead, the fracture site has a fixation device placed through the skin, or transcutaneous, okay, and then it's placed in holding the fracture fragments together. Okay. There is also terminology often used called reduction of a fracture, but the word reduction, we use the main term manipulation for that. Okay, so reduction equals manipulation. Manipulation is the CPT language that equates to that. So do read through this section here, and it provides more information on what's going on in the treatments. But again, what matters is the type of treatment offered as far as your CPT code selection. Internal fixation is only going to occur during an open fracture treatment. Okay. If we go further on in this section in your textbook, it talks about fracture treatment of fingers, toes, that type of thing, and keeping your eyes out for multiple treatments, or if each finger, so to speak, is treated. If more than one finger or toe is fractured and treated, the coder should report a code, one for each, and then you are going to have the modifier on there that will identify whether it's T1, T2, and so on, according to the toes and finger modifiers, which we covered in a previous chapter. So what's really nice in your book is that it provides you with a statement: the following questions must be answered before coding the treatment of fractures and dislocations. Okay, so what's the site? What's the treatment? Was manipulation part of it? And then were internal or external fixation devices used? Coding for casts and traction and so on, and this is something that was mentioned early on in the beginning part of the chapter here, that with fracture repair, the initial placement of the cast or traction device is included in the fracture repair in the first placement. So be very, very careful for that. Next, we will move on to repair, revision, or reconstruction codes, and for the most part here we are talking about tendons. Those are your main terms: repair, revision, or reconstruction. What we want to talk about in here, as your text does, is primary repair and secondary repair. So primary repair is the first repair of any structure or tendon, okay? And this can happen right after the tendon injury. The patient comes to see the doctor or ER or surgery right away. Or maybe this injury happened a week ago, but they're now for the first time coming to see the doctor, and they do a repair. It's still a primary repair. Primary refers to the first repair. A secondary repair is only done if a primary repair has been done sometime prior to. You have a nice definition there of no man's land. I'll just leave that to your reading. The next type of repair, reconstruction, we have our arthroplasties, repairs of joints, whether it's all of a joint or part of a joint, and you can read what is meant by part or all of a joint in your textbook there, sort of educate yourself, and having the choice of a hemiarthroplasty, and that's repairing only part of it. And your book also mentions that hemi and partial mean the same thing for our coding world. Now sometimes arthroplasties are performed, and they are what's termed as converted to more of an open procedure, and there is a specific code that says conversion from an arthroplasty to the open, and your book talks about the hip as the joint that happens most often in. So main term can also be arthroplasty rather than reconstruction or repair of a joint. Arthroplasty, surgical repair of a joint. Next, we will talk about the spine or the vertebral column. There's specific naming conventions for whether we're talking about an individual vertebrae or multiple vertebrae, or even the joint in between the vertebrae. So do read through this part of the chapter and be careful when you're reading the op reports and charts for procedures on the vertebral column to be sure that you know what's being talked about. That is, one vertebrae, two separate vertebrae, or maybe the space in between the vertebrae. So a little anatomy review there as well. Moving down to the procedure, spinal fusion on the vertebral column. Arthrodesis, if you remember that term for medical terminology, is desis, meaning putting together, and then that would be a joint. So this is where oftentimes bone grafts are used, or sometimes even cement are used to put two vertebrae together so they no longer move. So you'll want to be careful again in the op report to see how many vertebrae or how many joints they are actually fusing together. Desis meaning fusing. Now, a lot of times it's not appropriate to use the 51 multiple procedure modifier when they're doing 2 or 3 different joints. You are just identifying the joints. And in some cases, the symbols are being used to indicate an add-on code, which again, it's not appropriate to do the 51 modifier with add-on codes, but you may want to review that modifier in the previous chapter again to get a handle on that situation. Sometimes arthrodesis is performed along with disectomies, and so when there is a combination code, such as in those situations, you want to use the combination code rather than separate out into individual codes. Additionally, sometimes when the spinal fusion is taking place, there's instrumentation that are rods, pins, and so on. That's what instrumentation means, and so if your op report indicates that, you need to add those fixation or instrumentation codes on. You have some good examples listed in your textbook and your documentation checkup. For practice, your answer is provided in the end of the index, so I would pause the recording and take some time to work through that practice. And a couple last notes regarding the spinal column. This is after your documentation checkup. Your distraction devices, your vertebroplasties, kyphoplasty. Main terms are fairly straightforward there. The vertebroplasty is the main term. Kyphoplasty is the main term. Might be repair of the spinal column. And the information that you have in your textbook about the devices and those plasties is just pretty much explaining what they are, which is always helpful in understanding our coding. And so this is going to end the second recording for the musculoskeletal system, and we'll have one other short recording for the remaining portions of this surgery section.